And time to talk to the doc. No, you're not confused. It's not Tuesday. It's Wednesday, and it was my scheduling conflict, so I want to state that right up front. But thank you, Dr. Tim McKnight, for graciously coming in on Wednesday instead of Tuesday. Thank you for that.
No problem, Steve. Thanks.
Good to catch up with you, and I'm confused here because we always talk on Tuesday. That is Fit for Life night, which was last night, so we'll come back and talk about that. But I was watching the evening news last week, and they came on and said breakthrough news for heart studies and heart patients, and proceeded to talk about this change in the way they handle somebody with possibly chest pains. You could possibly be sent to the hospital, and then they would put a stent in.
Right.
And this was stating that that procedure was being questioned as validity as far as instead of maybe using statins or aspirin.
Right.
And that they were going to change the way this is done. So was this a landmark finding with the Heart Association meetings?
It's a really good question because it definitely catches people's eye and they pay attention to it.
Right.
Yeah, it was the annual meeting of the American Heart Association, and the news headline was this landmark study. Mm-hmm. And as you said, they looked at statins versus bypass surgery versus stents. And so they had over 5,000 patients in this study, 37 countries, and they put them all on statins and aspirin. And then they took half of that group and they said, for this group, we're going to either do a stent for their blockages or bypass surgery.
Right.
And then we're going to follow them and see which of the two groups does better. Do they do better long term if we intervene surgically, or if we just use the cholesterol medicines with aspirin and lifestyle changes, which that's the question I have. How intense is that lifestyle change?
Yeah, you see, that was one of the things I don't think that I heard much about as far as lifestyle. It was basically cut and dry, either the stent or surgery or the medication. So, but you're right, that's the key.
Yeah, so some lifestyle interventions are much more aggressive than others, and they didn't really define that. But the bottom line, when they looked at these two groups, was that heart attack rates, hospitalization rates, and death rates were no different in the two groups.
Really?
So doing the surgical intervention didn't really change the outcome. And we know, we talked about this in Fit for Life, that when you do bypass surgeries, the disease continues to progress. When you put a stent in, you're opening up a blocked area, but if your lifestyle doesn't change significantly,
it's not going to
the
get
disease
any better.
Progresses, and you'll have a blockage eventually someplace else. So this really isn't anything new. But it's really interesting to me that the leader of the study, she said, and I'll try to say it exactly the way she said it when I listened to it, she said, statins are the miracle drug, amazing drug. And I just thought, okay, come on. You know, we do know that when you have heart disease and you have blockages, statins can benefit you in terms of longevity. But as a primary prevention, it doesn't do anything. So just because your cholesterol is high isn't preventive. And the other important point, we actually talked about this last night in Fit for Life when we talked about hormones, is the hormones that keep us young and fit and vibrant and active, testosterone and estrogen and progesterone and dihydroepiandrosterone. It's called DHEA. Those are all steroid hormones, and you need cholesterol to make those hormones. So if I put you on a cholesterol blocking drug, I block the cholesterol, but I also block
a lot
your
of other
hormones. And so we talked about this, if you take a man's testosterone away from him, as we do sometimes with prostate cancer, they will become very depressed, very tired. They'll lose their drive to do anything, and actually their suicide rates go up pretty high.
Wow.
So it's like, well, do we really want to block these hormones that are good for us? And many of us, as we hit 40, 50, and 60, we're struggling with those levels, and we need a little boost.
Right.
So I just thought, the results of this, I don't know how this was a landmark study. I guess the one thing they did say was that those that had surgical interventions, particularly the stents, they had less symptoms. They had less shortness of breath with exertion because you're opening up a blockage.
Sure.
But long term, if your lifestyle doesn't change significantly, the disease progresses.
Right.
And the bypass grafts that we use, they often get plugged up within a year and a half. Up to half of those get plugged up. So none of these are really good long term cures unless you really change your lifestyle. And we also know that with diabetes, because this study was done about 15 years ago looking at different interventions for diabetes. Is it this class of drug, this class, or lifestyle? And the conclusion was no. If you change your lifestyle significantly, that's the best way to impact diabetes. So it's always lifestyle, and that's why we do Fit for Life.
Exactly, good point. And hearing you say this as a medical doctor, and questioning some of these findings, I wonder how many other doctors in your situation are saying the same thing here. Yeah, it's interesting study, but hands down, it's not the be-all, tell-all story here.
Well, I'll tell you, the doctors that have been trained in hormone replacement therapy understand this, and they would say the same thing. In fact, it was a couple years ago at a conference I was at, we spent 2 hours looking at the latest recommendations for cholesterol medications and who should take it and what dose they should take. And when you looked at this study, the study was completely flawed. This is our 4th revision on cholesterol medications, completely flawed. There's no evidence that taking cholesterol medication, if you don't have heart disease, prevents heart disease.
Yeah, interesting.
So this isn't something that most providers think of, because we can clearly lower your cholesterol level, but that doesn't always translate into less heart disease. But that's what we're taught, and that's what we do, and we don't question it. And so when this leader of this study says statins are the miracle drug,
right,
it's an amazing drug,
right.
Well, I don't really agree with that. I think there is a place for some people, but for the most part, there's a lot of consequences to taking those when you don't need them.
And I'm guessing we'll be talking about this as the debate continues and more questions are asked. So, as I said, this was, as they called, landmark discovery, but not the end of the debate.
No, it really comes down to doing the hardest thing there is, which is changing your lifestyle, changing your eating habits, exercising. But a pill, unfortunately, many medications are pretty expensive, and that becomes prohibitive.
Sure.
But,
right.
We're in this quick fix mindset right now.
Absolutely.
And we need to change it.
Speaking of which, we're heading into a tough season for a lot of people. With the holidays, you're going to be going to parties. You're going to be seeing food show up at offices and everywhere you go, cookies baked. And they say the average American is going to put on about 6 pounds over the next month and a half. Is that realistic? I mean, that's a lot of weight.
That probably is realistic. A lot of that is probably water weight. I don't think that it's all 6 pounds of fat.
Right.
But you're right. There's going to be a lot of carbs, a lot of sweets eaten over the holidays. And I guess my advice, number one, is to try to limit that as much as you can. But number two, when we're talking about weight gain, it's about insulin. The more insulin you make, the more weight you will gain. So if you're going to splurge at a work party on the holiday food, maybe the next day you need to do a 24-hour fast, because that will lower the insulin and kind of negate that excess.
It's going to be a tough challenge for everybody over the next couple of weeks to have willpower and step away from those cookies.
For me, it's better just to not see it. Stay away from it. You don't have to have willpower.
I'm with you 100%. Let's see. Last night was week
11. Yes.
And so one more week. Next week is award night, and
we're having our awards. And we're wrapping up, reviewing what we've learned. Yeah.
So the topic last night.
Last night we talked about disease prevention. We talked about the role of immunizations, the screening tests that are recommended to prevent most cancers or many cancers, and then we talked a lot about the benefits and pros and cons of hormone replacement therapy.
Okay. And next week is a lot of fun when you look back at what you've achieved over the course and how it's changed the way you view your health. And I mean, it's really a cool thing.
I had a participant last night came up with a piece of paper, and she said, "Look how much I've lost." In the last 2 years, I think she's lost 81 pounds.
Wow.
She's 15 pounds away from her goal. And she said, "I've taken this class 4 times.
No kidding.
And every time I'm inspired by it." And
That
she
is
was
awesome.
just beaming.
She's
like,
great.
"I feel so great, and this works so well if you do it."
That's what makes the whole thing worthwhile,
I said,
isn't it?
"You have to tell this story next week.
That's
the
great.
class has to hear what you've been through."
That is so cool. So, and again, limited space for the January session, because this one, Fit for Life, is going on the road. You're going to be doing this one at the hospice location.
That's right. We're doing it community Trinity Hospice. Many of their employees want to take the course, but there's still room for the community to sign up.
Yes, but don't delay. If it's something you want to do, Fit for Life, the January session, by all means, get a hold of Dr. McKnight's office or Trinity Hospital and get signed up, because it is life-changing, and appreciate all the knowledge that you share with our listeners each and every week.
Well, thank you. I have fun with it. My biggest challenge is keeping the presentations to an hour and a half or less, because I have more and more to share, and
it is
a limited amount of time. But
it's great. And with that being said, we want to let everybody know too that what we talk about here in the morning, these are always posted on our website. So if you miss something we're talking about, you can even go back, listen to the archives, and talk to the doc with our recorded sessions on our website.
That's right. We're kind of hitting the highlights of each class, so I think that's a great idea.
Right. So browse through that and then make the decision if you want to get involved with the Fit for Life program for the January session. Talk to the doc, Dr. Tim McKnight. Always good to catch up. And even though it's a Wednesday, we appreciate you coming in.
Thank you. I appreciate it.
All right. Dr. Tim McKnight in studio with Talk to the Doc, and, of course, on staff at Trinity Hospital, Twin City. It is 8:46.